Good afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor of Madison 365, with your daily news update on the coronavirus situation here in Wisconsin and a couple other items as well. My thanks to Stephanie Diaz de Leon for pinch hitting over the weekend, as just on the website on madison365.org with the written news stories each day, keeping you updated on the coronavirus situation. Here in Wisconsin, and while I was away for the weekend, I'm just sorry, I'm stumbling a little bit here. I'm just checking, making sure. For a minute there, I thought I had the wrong notes, but I don't. My notes are good. Okay, so here's where we are today. We have 174 new cases today. It's been pretty typical in the last month or two that on Mondays the number of cases is a little bit on the low side, partially because the number of tests is on the low side, and that is true today. It's actually lower, the number of tests, I should say, is considerably lower today than it has been even the past few Mondays. Let me get that number for you quick. It's fewer than 7,000 tests processed in the past 24 hours, which is considerably lower even than over the weekend. Yes, 6,255 tests reported in the past 24 hours. By contrast, yesterday on Sunday, the state reported 9,200 tests, and on Saturday it was over 11,000. The goal, the governor's stated goal, has been 12,000 a day. So we're just over half of what we're supposed to be for today. So, that's not great news. But of those 2.8% were positive. So that's good. It's a little higher than it was yesterday, but it is, which, not a lot higher, but a little bit higher than it was yesterday. Yesterday was 2.5. And so today the 2.8 is a little higher, but it's still under 3, which is where you want to keep it. As long as that percentage is under 3, where we can consider ourselves in good shape in terms of having the virus under control and doing enough testing. The statewide total now of the entire crisis is now 22,932 cases. We will pass 23,000 cases tomorrow. And we've had 2 more fatalities overnight. One in Adams County, one in Waukesha County. Interesting to note, one of them was an Asian American person, and one was a Hispanic person. We'll talk a bit more about racial disparities in a few minutes. One piece of very good news. The state now says 71% of cases have recovered and 3% have died. So that fatality rate has gone down, which we knew it would. As more cases are discovered, as more people are able to get tested, the number of cases will go up and the percentage of people who die will go down. So, that was 4% not very long ago. Now it's down to 3%. But the best news out of that is that only, something like 24% of cases are currently active, and that number is about 5,400. Now, even about a week and a half ago, that was like 6,300. Okay, so in the past week and a half, past 10 days or so, roughly, give or take, you've had about 1,000 people fewer that currently have contagious infection, right? Which means that people are recovering faster than are being contracting the disease. More people are recovering each day than are catching the virus, which is that's the way this is going to continue to go down. So that's good news that we've had the active cases go from about 6,300 down to about 5,400, and the fact that we're we're catching more cases, although you'd like to see more testing than we have today. That means basically that we can have those 6,400 people isolated and quarantined so they're not spreading the virus. A few localities, a few counties are having some issues. The largest local increase today comes from Milwaukee County with 77 new cases, but they're lower than 4%. They're 3.77% of tests coming back positive in Milwaukee County, but still 77 new cases is the highest individual county. Other new cases, there's fewer than 100 cases in the rest of the state, and there are a handful of places that we've talked about before that have just a very small number of new cases, but also a very small number of tests, which means that they're really in some of these rural counties, they're only testing people who are already sick and already showing symptoms, which is not the best way to mitigate the spread of the pandemic. So, for example, Lafayette County, we've mentioned a few times, very rural county in southwestern Wisconsin, has only 2 new cases today, but those 2 new cases are 13% of the tests they did. Langlade County, another rural county, has 1 new case but only did 5 tests. So that 5 people were sick, got tested, 1 of them was positive. That's 20%, which is really high as compared to the state at 2.8%. O'Connor County, similarly, 1 new case but only 2 tests. So half of their tests yesterday were positive. Pierce County, 3 new cases, at 13% positive. Taylor County, 2 new cases, 12% positive tests. Trempealeau County, 7 new cases in Trempealeau County. That's 24% of positive tests. Washington County, 4 new cases, 33% positive tests. And Waukesha County, 11 new cases, but 41% positive tests. So again, the rest of the state, other than those counties, was low enough to keep that statewide rate down to 2.8%. But there are a few counties where flare-ups are getting ready to happen. Lafayette County is one we've heard a lot about. Washington County, Waukesha County continue to be to grow sort of steadily. We're not seeing that big exponential growth that you worry about, but we're seeing steady growth in those counties. That doesn't bode very well. Dane County, where we are here in Madison, saw an increase of 12 cases. It was a smaller percentage, under 4% of positive tests. But what's interesting about Dane County is of those 12 cases, 6 of them were people in their 20s. We've seen, just in the past week, we've seen a real sharp increase in the number of people who are infected who are young. Overall, we've seen 113 cases in the past week here in Dane County. That's an increase of 13%. This is, the whole month of April and most of May, we saw 2 or 3 cases a day here in Dane County. Now we're in the 20s every day, except for today we're at 12. But, the last several days we've been in 19, 20, 32, that area. In the past week, infection in people aged 20 to 29 increased 23%. And cases in children aged 10 to 19 increased 29%. So there's these age groups that are really young age groups that are really starting to rapidly increase the number of cases. And today, you may have heard, today Dane County moves into phase 2 of the Forward Dane reopening plan, which means as of today, restaurants can be up to 50% capacity. You can have indoor gatherings up to 50 people, outdoor gatherings up to 100, and so on, based on some metrics like new cases, percentage of tests, hospital capacities, those kind of things. Speaking of hospitals, hospitalizations are down again today, which is good news. 284 people currently in the hospital. That's down 38 from a week ago. So the number of people hospitalized has been going down steadily for the past week. Of those currently hospitalized, we have 100 people in intensive care. so a little over a third. And then there are still 196 people in the hospital awaiting test results. I mentioned racial disparities earlier. 33%, 1 out of 3, of the almost 23,000 people who have coronavirus in Wisconsin are Latino. Latino people make up only 7% of the state's population. So they're, almost 5 times as likely to have coronavirus as any other ethnic group. At 29% of today's new cases. So dang near 1 out of 3 of today's new cases are Latino. Black people, similar. They're 6% of the state's population. 19% of all cases are black. 10% of today's cases are black. It's almost double their proportion of the population. 25% of total coronavirus deaths are black people. So if you're black in Wisconsin, you're about 3 times as likely to get coronavirus. And if you get it, you're about 4 times as likely to die from it as anyone else. And that's not genetic, it's not biological, it's purely job, what kind of job you can have, what kind of job you have, and access to healthcare. Rate of transmission is the number we talk about every day, and it's related to, it's basically the rate of transmission is the average number of people that are infected by each infected person. So if that number is 3, which it was early on, it means if I get infected, on average, I'm likely to infect 3 other people, and each of them will then infect 3 other people, and the virus will spread like crazy. If that is under 1, that means that's where we are now, where we get more people recovering than you get getting infected. So we are now at 0.89, just a tiny bit higher than it was last week. It was 0.88 last week, so it's like 1/100th of 1 point higher, which is not significant. So as long as that stays low, stays under 1, and we're actually at this moment, you've heard, I'm sure, about other states having more outbreaks as they open up, and there are now 18 states that are above 1, which is not good news at all. Wisconsin is in the lower third of states in terms of rate of transmission. New York is at 0.77. Hawaii is at 1.17. So we're down toward the bottom of that range, which is exactly where we want to be. Okay, so that's the coronavirus situation. We're continue to be in pretty good shape, with the exception of a few local spots. Most of the state is open now. Dane County is just entering phase 2. The city of Milwaukee is reopening for the most part, and I think people are still being cautious, and a lot of people are still being very cautious, even though just because the restaurant's open doesn't mean you have to go there. A lot of people still wearing masks, which is good. I was just up in Dane County over the weekend, and I did see a few gas stations were only allowing 5 people in at a time. Even though you haven't seen a big outbreak in Dane County, people are still all around the state being really cautious. Dane County's only seen 25 cases total, and but a lot of the gas stations up there, a lot of the boat rental places are still closed, just to be cautious. So that's pretty good. A couple other things to note: University of Wisconsin campuses are going to be opening in the fall, which a lot of people think could lead to more outbreaks. It seems to me, my amateur journalist analysis here, that one of the reasons we haven't seen a big spike after the reopening, the state of Wisconsin was forced to reopen rather suddenly because of a state Supreme Court ruling. Everybody was really worried about a big spike in cases, and we did see an increase exactly 2 weeks later, but that has since gone away. And I believe, in my opinion, that one of the reasons for that is that schools are still out. that what we've heard from epidemiologists, and this is what this is not an uninformed opinion. This is like based on what I've done in interviews with epidemiologists through my job here, is that it spreads the most quickly when you're indoors with the same group of people for a long period of time. Because your breath and your talking and the little droplets that just come from you float in the air wherever you are for up to like 14 minutes. So if you're outdoors and you're walking around and you're moving around and everybody's kind of spread out and there's wind blowing stuff around, it's just not as likely to spread in that setting. Once we get people sitting in restaurants together for long periods of time, and in schools and in universities and classrooms where you're with the same group of people for an hour or more, or in the case of K-12 schools, like 8 hours indoors with the same group of people, I would not be shocked to see a lot of spread happening once the schools open. But UW system has said campuses can open. What that means for the University of Wisconsin in Madison or each individual campus still remains to be seen. I'm kind of hearing through the grapevine and just kind of casual discussions is that labs and things where you have to be present to learn will still continue. Will meet on campus, whereas other classes, especially larger lecture type classes where there's 100 people in the class, might stay virtual or stay online. I will say also that the PEOPLE program, which is a program at the University of Wisconsin, Madison, that basically recruits middle school and early high school age kids to come for the summer. They go actually stay on campus for the 2 weeks in the summer to get them a taste of the college life, and they sort of nurture these kids from disadvantaged kids of color mostly, from Milwaukee, Madison, kind of nurture them into being ready for college, and then basically actually give them scholarships if they complete this program through middle school and high school. You earn a scholarship into college, and most of them are pretty successful in college. In fact, our reporter Malik Anderson was a PEOPLE scholar, and it helped him through college. And he's a terrific reporter, as you know, if you read us. But Malik has a story that we're going to publish tomorrow morning, that the PEOPLE program this summer is going virtual. They're not going to bring kids onto campus during the summer. And the slogan they've come up with, which is quite clever, is prepare to achieve virtually anything. Get it? Virtually. So that's a big shift for that program, because being on campus is part of the whole deal of that program. So to do it virtually is going to be really interesting. But that story will be on Madison365.org tomorrow morning. Okay, that's what I have for you today. Shoot us an email, news@Madison365. If you have questions or comments, stories you think we need to follow, and Madison365.org/donate if you'd like to make a donation. We're a nonprofit newsroom. One other thing I want to mention before I forget is on Wednesday this week, we're going to have another virtual summit, virtual racial justice summit, 3 town hall conversations led by young people. We're going to hear from the youth leaders about the Black Lives Matter movement and the situation here. All of the panelists, we're going to have Henry Sanders, our CEO, and Michael Johnson from the Boys and Girls Club kind of moderate the discussion, but they're going to really let youth lead those discussions, and all the panelists will be African American people aged 16 to 25. That will start at 11 o'clock on Wednesday, and should be a really interesting conversation, and I'm really looking forward to it, and I hope you can join us. It'll be streamed right here live on our Facebook page. All right, have a wonderful evening, and we will talk to you tomorrow.